Hi guys, this is Eva from Bay Harbour Med Spa. So since I made my previous first video about microneedling and stretch marks, I was bombarded, if not 1,000 questions about that subject. So I want to take this subject up and I want to explain a little bit more so you guys understand. Am I a miracle worker? Can microneedling get rid of your stretch marks? Not completely. Who are the best candidates to benefit from microneedling and stretch marks? Girls that are 14, 16, 18. Girls that just started to get stretch marks. And they use my serum and they use the microneedling instrument for the body. They can expect an improvement. However, please do understand that a stretch mark is a tear, an indentation in the skin. The older the stretch mark is, so if you had babies, you were pregnant, and you have stretch marks on your belly, and they are 5 years old, and you want me to get rid of your stretch marks, please don't bother buying the microneedling for your body because you won't get rid of it. The only way you will get rid of it is nipping it off, going to a plastic surgeon, pulling your tummy up, getting rid of the skin. That's the only way you will get rid of it. But if you are very, very young and you just started to get stretch marks, or you have them for a year or two, but you're still very young, then it makes sense to come and or get clinical treatments here and continue at home. And if you can't come here, you can buy the microneedling system for at home and you can use it, and it will help to stimulate the regrowth of new cells and help to reduce the visibility of the stretch mark. But can it get rid of it completely? No. No such animal, no such thing. It cannot get rid of it completely because remember, the stretch mark is an injury. It's a scar in the skin. So all we are trying to do is stimulate the tissue, stimulate the skin, stimulate the cells so that they regrow. And when you are very young, very, very young, and you are in the process, still everything turns around till about 26, 27. Then everything starts slowing down. So if you're very young and you do this and we do the treatment and you do them at home and you use the appropriate serums with it, you will have much better results than somebody who is 30 or 35 and has stretch marks and they have them for 7 years or 5 years. So it can work perfectly well on very young people, on very fresh stretch marks. Even for guys, if you're a man, and a lot of guys who work out in the gym, and I work with a lot of body workers, bodybuilders, sorry. And when bodybuilders come to me because they want to get rid of the hair on the body, so we do laser removal for the whole body. Many times when guys do bodybuilding, the skin stretches and they get stretch marks on the area. So as long as they are fresh, you come and you can treat it. So the answer is when it's fresh, yes, for girls, for women, for men, as long as they are fresh, as long as they are new. If they are over a year old, it will be harder. It will be possible to improve, but it won't be possible to get rid of it completely. Please understand that. So I hope that I clarified this, and that I'm sorry if I disappoint you and I can't give you a magic potion and a magic roller and say, okay, buy this and it will get rid of it. No. As I said in my other video, prevention is much better than correction, much easier. So those of you who want to know what you can do to prevent stretch marks, I spoke about it in my previous video, and I said start using organic coconut or coconut butter. You can buy it at Costco for about less than $20. You get a big jar like this and use it. If you feel that you are changing, if your body you work out and your body is expanding, you know that there are going to be changes, Please put it on every day, morning and evening on your skin, so it gives some nourishment and gives some elasticity and a give, so the skin can stretch a little more. If you are pregnant or you're gaining weight, immediately as you change, your body start changing and expanding, start using it. So we are talking about prevention. Corrections is much harder. Okay? So until next time, thank you for listening, and I'll be back again. Bye, Ava.